Welcome back to another episode of the Blessing Health System podcast, where we discuss topics important to you and your family when it comes to health and wellness. In June, it's Men's Health Month, and we'd love to dive into some topics with some of our favorite providers in all things that regard to a man's well-being. Today, we've got Dr. Bradley Holland from our urology department. Dr. Holland, thanks for being here, and if you wouldn't mind to start off, just giving us a little bit of background on your medical education and history.
Yeah, thanks for having me. So I've been a urologist at Blessing for 3 years now. Before that, I was in Springfield for 5 years with residency, and I'm actually from Central Illinois in the Springfield area, so not too far from home.
We're talking erectile dysfunction today, ED as it's more commonly known, and it's a little bit of a topic that sometimes for guys to discuss can be a little bit hard. It's a little bit of a sensitive subject for most men. It's a stigma that we're really trying to break here in this discussion. It's a topic that we want guys to feel comfortable talking about, whether it's with themselves, whether it's with their partner, just accepting what ED is, how it works. And so if you wouldn't mind to start off, when you hear the words erectile dysfunction, the initial thought is nothing's working. And that's not necessarily the case, is it? There's probably certain levels to it, certain layers to it. If you can just kind of give us maybe a brief rundown of what it really means and really how it affects a man.
Yeah, the spectrum of especially sexual dysfunction as a whole, but then diving down into erectile dysfunction specifically, there's quite a spectrum of what the disease is and how it presents in guys. Really, as ED itself, that is just the inability to be able to penetrate with an erection. So not able to maintain an erection, not able to achieve an erection, or just not able to get a strong enough erection. But any of those factors and anywhere kind of on that spectrum of disease is considered erectile dysfunction.
When you break down to the real technicalities and the real functionality of works, a lot of it relates to blood flow. Can you explain a little bit, maybe in some common sense terms, how that kind of operates and maybe what isn't working in regards to blood flow that can cause that?
Yeah, it's entirely getting enough blood into the penis and sustaining the erection. So if you can't get enough blood flow in, or if that blood flow is leaking out too fast, then you're not going to be able to attain the erection. So it all comes down to and that's actually how it's similar to a lot of other diseases, but it all has to do with that blood flow in.
Is it something that is a hereditary factor? Is it something that just, like they say, you hear it on TV quite often when they joke about it in a program? It happens to a lot of guys. That's the phrase you'll hear in television and entertainment. How common really is it for most males to experience something like this sometime in their life?
Yeah, like a lot of medical conditions that involve private areas, people don't like to be as open about it, don't like to talk about it as much, but it is incredibly common. I mean, even guys aged in their 20s, about 8 to 10% of guys experience some degree of erectile dysfunction. And then as you get older, one of the better studies on it, for guys 50 to 70 or 40 to 70, it was over 50% of guys have some degree of erectile dysfunction. And there's around 40 plus million men that are searching for care for erectile dysfunction in the U.S. So incredibly common disease.
Let's talk about younger guys for just a few minutes. You just mentioned that it can affect younger men. And when you're young, virile, strong, you feel like you're on top of the world necessarily, that this isn't something that should happen to you. When it comes to younger men, what factors might be into play more than, say, somebody in their 40s and up that might be affecting them? Yeah,
definitely more the psychological factors, I think, come in. Erections and sexual health really responds a lot to stressors in your life, whether it could have nothing to do with the relationship at all, but just stress in general. And so it definitely can happen off and on to guys, but any kind of persistent erectile dysfunction really needs to be worked up and really needs to see a provider for.
Let's talk a little bit about medications that somebody might be taking, whether it's for a heart condition, whether it's for smoking, for your lungs, for anything that it might be. How much can a medication play into that? And as a provider, how much do you want to know about that when you might be visiting with a patient regarding this? Yeah,
there's a couple different ways that the medications can play a role, especially some of the different heart disease medications or high blood pressure medications can maybe worsen erectile dysfunction. But some of that is that their body's gotten used to their blood pressure being really high at an unsafe level. So when you bring it down, the blood flow into the penis isn't as good. But the trade-off of that is if they maintain that high blood pressure, it's just going to cause more damage. So it really has to be done. And one of the big things is guys think that when they're on these medications that there's no other option, that they're just not going to get erections because they're on these medications. But we have treatment options beyond that, and treatment options that can get erections beyond just a medication that might be making it more difficult.
Let's dive into that for just a second, because everyone's so used to terms like Viagra and all of these, commercial terms that you've heard for 20 years now, ever since that jumped into the scene. What other treatment options are there out there for guys that might not involve taking a small pill? Yeah.
Well, and to start with the medications, when those first came out, they were very expensive. And that was a big hindrance for a lot of guys. Now, especially Viagra and Cialis are both generic. So that's come a long way in making it much more accessible for everyone to really be able to afford. But then beyond that, at Blessing, we offer all 5 of the AUA recommended treatment options for erectile dysfunction. And a lot of guys, I think, get to those medications and maybe progress beyond them where they're not working great or they're working kind of off and on, and then think they're done. I think there's nothing else. And one of the biggest things about getting the word out about erectile dysfunction is just encouraging guys to seek treatment, because if that's important to you, we have options beyond that. I mean, we have everything from injections to vacuum pumps to penile implants that we do quite a few of, and they really have a great satisfaction rate and recommendation rate for guys that are seeking treatment.
When we talk about breaking the stigma on erectile dysfunction and what it means, what we're really trying to get down to, I think, is personal satisfaction. Mm-hmm. You want to be a great partner. You want to feel strong. You want to feel independent as a man. And so often, I think the term comes with a feeling of feeling broken. Mm-hmm. When you deal with a lot of patients, what's that discussion like to kind of change that tone for them, to make them understand that we're improving your life, we're not fixing something broken per se?
Yeah. I mean, a huge part of it, and really one of the reasons that I like urology, is that there needs to be people that you can talk about with anything, and there's going to be no stigma. I mean, it's sexual health is health, and people, I don't know, it's very upsetting that people think that there's nothing left, and they think that part of them's gone, when if it's important to you, we have options for it, and it's going to work. It might take some time, but the options will work.
On top of medication, the body and your genitalia, just like anything else, is probably dependent a little bit upon your lifestyle choices when it comes to eating, drinking, smoking, exercise. How do factors like that externally play into your potential to experience erectile dysfunction or to subside it?
Yeah, smoking is definitely a big one. Smoking hurts the blood vessels of the body, and specifically the smaller blood vessels. So the blood vessels going into the penis are some of the smallest in the body, or some of the smallest functioning ones. They're smaller even than the blood vessels surrounding the heart. So it can be the first sign that smoking or obesity or even poor diet might be affecting your body, is that it is hurting your erections. And we have seen that in guys who are heavy smokers or who do live a pretty sedentary life, that if you make some of those changes, it can improve your erectile dysfunction. It might not make you like you're 18 again, but it does improve things.
Getting out, getting mobile, exercising, just moving, all of that stuff that would help normally improve blood flow to any other organ will also help you below the belt, pretty much.
Absolutely.
All right, great. There are a lot of myths and homemade cures out there. You'll hear a guy say, man, my grandmother or grandfather used to tell me about something that they would mix into a pot and swallow that down, and it tasted awful, but it helped him out like a charm. When it comes to like homemade cures and stuff like that, what are some myths and other fallacies that you hear as a provider that just simply really aren't true in terms of trying to help in that regard?
Yeah, I think erectile dysfunction or sexual dysfunction in general is really prone to a lot of those kind of things. Probably because it is a stigma and people don't want to talk about it as much. So there's more Googling, there's more, late night infomercials talking about all these crazy things, and that old one with the guy smiling with a thumbs up and that. But a lot of those really don't pan out. They really don't work. And there's everything from the things online, the things on those infomercials, the things you can get at like adult stores and that that really don't have any lasting benefit. Sometimes they do kind of improve blood flow in the short term, but a lot of those aren't FDA approved. Actually, almost all of them aren't FDA approved. And so it could be causing other harm that you don't know about. So we really caution people on picking up a lot of those things unless they're directly recommended by one of us or a cardiologist or somebody like that.
If I'm a first-time patient with you, walk through what that experience is going to be like. What's that discussion going to be like as a man that comes in and says, I'm really struggling here, and they're frustrated and they feel a little bit down? What's that conversation like initially to try and figure out what's happening with them and maybe to try and just pick up their spirits and pick up their confidence a little bit?
Yeah. No, a couple of the big things we hit on is some things we've talked about. I mean, seeing what their lifestyle is like, seeing what their medical history is like, and a huge one is making sure that they follow with the primary care physician, because sometimes, like we talked about with the blood vessels in the penis are smaller than the blood vessels in the heart, and sometimes that can be kind of a harbinger for things that could come. And so getting them established with the primary care, getting them established with somebody who's going to be able to follow them for those other care is really important. But then beyond that, it's with almost everyone who we talk about with erectile dysfunction, we go through all the options. Because I want them to know that, hey, if these pills don't work or that doesn't work or the injections don't work, we have options. And the biggest thing is if it's important to you, I want you to keep working and keep working with us, and we'll get a treatment that will work.
Let's go back to something you just talked about there, was that this is usually maybe a harbinger for something else, and that's why the PCP is so important. When you're talking about that, are you asking about other medical conditions, family history, things like that? Because like you said, maybe this is leading to something bigger that maybe someone else should take a look at.
Yeah. The biggest one is heart disease, especially early onset erectile dysfunction. So in their 30s or in their 20s. And if you kind of weed out the really stressful ones or the ones that are off and on, but the persistent erectile dysfunction, that and people with a family history of heart disease are two very important things. And we really stress the need for primary care physicians there, and just making them aware of that so they can make the lifestyle changes so they can get set up with somebody who can get, the yearly blood work and the yearly exams and just make sure they're at risk so that they can keep an eye on it and hopefully address things before it is too late.
When we talk about breaking the stigma of erectile dysfunction and what entails with that, what I feel would be a big part of that would be getting confidence and getting reassurance from a partner, a spouse, whomever that is. For people that play that role in a man's life, how important is that to be encouraging, to support them and say, this is great. This is a great thing you're doing, maybe instead of saying, well, just go get it fixed. I think there's a big term in the conversation. What's that conversation like for a spouse or a partner to encourage and support? Yeah,
it's huge. It's huge. I mean, the especially when we start talking about the more advanced treatment options and the implants and things like that, having a partner on board is everything. And that's why we really encourage them to bring their partner and to have them there. And for each of the follow-ups and for things like injections or the implant and things that might take another person helping you do, it couldn't be more valuable. And then also, if they have any type of sexual dysfunction too, I mean, on the female side or the partner side, that could be playing a big role too. So having that discussion is very important.
For guys that might get subscribed or prescribed for a Cialis or Viagra or generic brand, what is the long-term plan for that? Does it just continue to work for the rest of your days, or is that something you find out that maybe it doesn't work as much as a man gets older? What's that like for 5, 10, 15 years down the road?
Yeah, it's super variable on how long that will work for. Some guys can be on the same dose of Cialis for their entire life, and it'll work great for them. But there will be some of those guys that progress and need something beyond it. The actual rate of that is super variable, though.
Anything else we should be talking about when it comes to erectile dysfunction, to ED? What other hot points are there that a man should know about? What other points are out there that a family member should know about? What are we missing today?
Yeah, I mean, I think The one big thing you see a lot is the stress on what their testosterone is and replacing their testosterone, and that's very important. And having a low testosterone can coincide with erectile dysfunction a lot. And I think some guys, and that comes back to the idea of these infomercials and the things you see online of testosterone boosting and all that. And it really doesn't improve their actual erections. It may improve the rest of their sexual function, but their erections themselves usually don't improve. But we always keep an eye on their testosterone, check their testosterone when they first present with erectile dysfunction. And now we do have a testosterone clinic to help these guys.
Well, Dr. Holland, we thank you so much for your time and your experience and expertise on this subject. And we encourage you guys out there, talk to your spouse, talk to your partner, let them know how you're feeling and what they might be able to do to support you. And of course, if you'd like to learn more about erectile dysfunction and treatments possible here at Blessing, we encourage you to visit us online anytime at blessinghealth.org. And we thank you once again for listening to another episode of our Blessing Health System podcast.